So it's your choice. There will be private insurance. There is no single payer in the world that doesn't have private insurance also. The question is how much private insurance, and why don't we leave that up to the American consumer to decide for themselves?
Right on.
And that's the essence of Barack Obama's plan, and I think it's a very, very good plan.
So I have another one and it's very similar actually. It says, I'm currently a 60% disabled through the Veterans Administration, but I have everything paid for at the VA facility. Why do the citizens of this country not have the benefits that I supposedly fought for? Why do they not have the same opportunity as I? Are you saying, Governor, that this would be sort of similar to this person's situation, but we'd be able to, that everyone would be able to get that kind of access to that kind of care?
If they wish, they would. That's if they can, if they wish. The Veterans Administration is also a single payer. All this business the Republicans keep talking about socialized medicine, they've been doing that for 44 years, and finally I think people realize that if you're in the Army, you've got socialized medicine. If you're in Congress, you've got socialized medicine. If you are over 65, you have socialized medicine. Look, you can have socialized medicine or not as you see fit, but the truth is that we're losing jobs because we don't have a system of health care that makes sense. Our system of health care requires businesses to pay for it, and it goes up at 3 times the rate of inflation. You can't run your business after a while. The automobile companies in this country wouldn't be in the shape they're in if we had Canada's healthcare system. So we're not telling Americans they have to have Canada's healthcare system or Britain's healthcare system or Germany's healthcare system. We're showing them 2 systems that exist here in America today. One is Medicare and one is private insurance. So let them choose.
Great. And I have some questions that also relate to healthcare and really relate to how we can do something about it, whether it's healthcare or any issue. So I've got one question from one of our members, Sue Ellen Lawton in Bellingham, Washington, asking, how do you envision DFA's role going forward, and how are we going to use organizing to get this change passed? And very similar question, how do we put progressive pressure on elected officials? And that comes from Jill Jones in Renton, Washington.
Well, look, you already are. The fact that Governor Corzine took the time to come to a meeting, a house party in New Jersey, means that he thinks that you're pretty important. So,
great.
These elected officials are not our enemies. These are elected officials just need to hear from us a lot, and they will do the right thing. You can't win in some of these swing districts in Minnesota and Iowa and places that we worked so hard to get Democrats elected after they haven't been for 30 years. You can't win without progressive voters, and we don't want to be unreasonable. All we want is choice. We want full consumer choice about what to do. We don't want that choice limited by insurance companies. We don't want that choice limited by ideology on the right.
Great. So it sounds like we need to get active, show up, and get involved and talk about what we want.
Well, the first thing is to sign that petition so we know who you are and mean it. And the Congress knows who you are, and we're serious about this. And then we're going to start to get organized. And as you said, Arshad, we're going to have folks all through the late spring and the summer when this bill is up for debate, hopefully work in their constituencies.
Absolutely. In fact, the reason that we're so ambitious here is if we've got 250,000 petition signatures, 250,000 petition signatures. I mean, that's a big number all in of itself. It's pretty ambitious. I mean, we put it out there, so now we really have to do it. But it's also, when you take it out and you divide it up into all of the different congressional districts. So say you're in California 11, which is I worked out there on a campaign, and you need to make sure that you're meeting with Jerry McNerney, who's the rep over there. We want to make sure that we're organized. So we are going to figure out who lives in that district who's signing the petition, and we're going to figure out how many of the other people in that district are also signing petitions, and we're going to organize, not only just canvases and phone banks, which we're going to do, but also making sure that we actually meet with Jerry and say, listen, this is something we really want, and I've come to you with this portion of our 250,000 members who've signed this petition. Of those, you've got 10,000 constituents, and I have all of their names and all their information right here. You've got these people that you've got to pay attention to. So that's why you're right, Governor. We got to get on this, and we got to.
Let me just say one more thing, Arshad. We worked really hard for 4 years to make sure we had a Democratic president. We didn't do that just because we wanted a Democratic president. We did that because now that the Democrats are in charge, we need to act like Democrats. There's some huge reforms that need to be accomplished in this country. Now we have our chance. We couldn't talk to Republicans about reforms about anything because they weren't interested. But now we have our chance. These are our folks. We worked so hard to get them into office. Now All we ask is that they do the things that they said they were going to do when they were campaigning, that they stand up for ordinary Americans, and that health care reform is right at the very, very top of the list for all of us, no matter what age we are, and no matter what our circumstances are. If you have health insurance, that's great, but you could lose it tomorrow, or you could get sick and have it canceled tomorrow, which I've had happen to some of my patients when I was practicing. And there's no reason we shouldn't have full choice. There's no reason, after all the work that we put in over the last 4 years, that we should, and with this huge majority that we have, we ought not to have choice. We're not asking for a single payer. We're not asking for socialized medicine or any of these kinds of things. We're just asking for the kind of choice that they have in other countries, and we ought to have that here.
That's great. And I'm getting a bunch of questions about sort of different approaches, this kind of stuff, but maybe I can boil that all down to, I mean, what is the acceptable compromise, or is there an acceptable compromise? Governor, at the beginning you said that there are certain things that absolutely must happen. What's sort of the minimum level here? Are we going to say that, are we going to let the insurance companies, say that you can only choose if you're such and such age, or if you're such and such health?
No, there's no reason for that. Look, why can't there's two groups that have the biggest problem with insurance in terms of not having any. One is people who are over 55 who have lost their jobs and can't get jobs with benefits anymore because nobody will insure them because they're over 55. And the other is people between the ages of 20 or maybe 18, really, if they're not in college, and about 28 or 30, who are not in the part of the job market where employer-based insurance can be counted on. Those are very different kinds of people. Why not just say to every American, you get a choice. If you like what you have, please keep it. But if you don't like what you have or it's not working for you, you can buy into Medicare. There's no reason not to have that. Medicare is more efficient. Its administrative costs are far lower. They don't have to pay dividends. They don't have to pay CEOs big salaries. They don't have to advertise. Their overhead is about 4% of the total dollars that go into Medicare, which is it's somewhere around 20 or 30%, sometimes even 50%. Let individuals choose what kind of insurance they want, no matter what age they are. Why can't all Americans have real choice? I think they should be able to, and I think that's what we ought to stand for.
Yeah, that actually, I wasn't going to ask this question, but I got this great question also online, and it says, it says, why does my employer choose my health care for me? They don't choose my car insurance, and they don't choose my, renter's insurance. So anyone should be able to have access to this, even if you don't have a job. Is that what you're saying? Absolutely
right, and the government will help you pay for some of it, in order if you can't afford it. Actually, one of the things that's small about this plan, money-wise, but is a big deal, is small businesses under 45 are not obligated to do anything about health insurance for their employees. That's a very positive thing for small businesses because small businesses create 80% of all the new jobs in this country. And people can take that money and they can buy private insurance with it, which will help them do, or they can buy into the public entity, which will be like Medicare, and let them choose that. But that takes a huge economic burden off the small business community. Neither party does much for small businesses, and now finally somebody wants to do something for small business. This would totally remake the small business community in America, and it would give their employees total freedom of choice.
I got a couple questions about preventative health care and how how that might keep costs down. Do you think if there is if through this system that people will be able to go to the doctor more often? Is that one way that we can keep costs down so they don't have to wait, or how does that all work out for?
Well, that's a more complicated problem. Having everybody with insurance makes a big difference because then you can start the education, the preventative stuff that isn't being done today, particularly for those without insurance. But the truth is, that's beyond the scope of a bill. What we need is to switch from an illness system where doctors get rewarded for fixing illnesses to a wellness system where doctors get rewarded and the whole system gets rewarded for keeping people well. And that's going to be a huge cultural shift in the country, not just a matter of legislation. That is ultimately what you have to do to control costs. And you can't get there unless you have a rational system. We do not have a rational system of health care in this country.